there's doing and then there's a command for what you're doing, right? And it's two different things. So within a few months, I'm rounding on patients with devices. We're having conversations about surgical site infections. You're applying those NHSN definitions that require you to be able to have those conversations. But I think it's been an evolution of having a depth of knowledge that allows me to lead and work with multidisciplinary groups to have stronger outcomes and strengthen process improvement efforts. That's probably what I would say. I mean, yeah, because you're rounding, and at first you just have your checklist and you're like asking this question, and then based on their answer, you're making a recommendation, right? But you're not maybe equipped to push back or challenge that decision, especially if you're talking about challenging a physician. So I think that's where just time in the field, you grow in your ability to have those conversations and push a little bit on things that maybe earlier in your career you would just accept.